Good afternoon, everyone. So I'm happy to be here to tell you a little bit about some work that the Center for Innovation is doing in collaboration with Arizona State University. About a year ago, Arizona State and Mayo CFI decided to embark on a project to help improve student health and well-being. And we decided to do that in a really specific way. The way the project works is that two designers from CFI, myself and Alexis are at Arizona State University in Tempe. We are on the campus, our lab is there, our offices are there, in a dorm, next to a counseling center and next to a tutoring center. So students are kind of around us all the time. We have a student research team who's working with us, and in the first year of the project, we've interacted with about 200 students in workshops, in in-depth ethnographic interviews, in online activities. The purpose of this is to, of course, improve student health and well-being. On the Mayo side, it's to really try to understand if we want to reach 200 million people by 2020, which is a charter that Dr. Noseworthy has charged us with, how do we do that? To reach 200 million young adults using social media or using any kind of device might not seem like such a big challenge. But to reach them in a meaningful way around their health are the questions that we're asking at ASU right now. I also wanted to mention that Allison and I are there at ASU in Tempe, but we also have two designers from Center for Innovation in Rochester who come out at these sort of critical times and interact with the students around transitions from pediatric to adult care. That's Molly McMahon. And another designer who works on wellness, Marnie Maylor. So there's a group of us, and we kind of move back and forth between Mayo Clinic. And part of our work is to try to understand, we're working sort of in this space between healthcare and education. So typically, somebody would work in healthcare, and then somebody would say, oh, and there's patient education. Or you'd work in education, and people say, oh, health is really important to be able to learn, right? Learn and have a good life. This project is squarely in the middle of those things. The sort of walls between blend as we work with student services at ASU. So we're thinking about analogies between the two systems. There's healthcare and education. At Mayo Clinic, there's a patient care team. There's a set of people whose job it is to make sure that the patient gets cared for, that the person makes it to their appointment, that the specialist is in communication with all the other people who are in charge of making sure that that patient gets care. Within the student scenario at ASU, there's also a care team in student services. There's the community advisor, which is the person on your dorm who's in charge of your floor. Used to call it an RA. Your academic advisor, people from the tutoring center. So there's this team of people who's there to help students improve their health and get in a state where they can learn and make the most of college while they're there, get a good education. We also look at connections between what it's like to be a medical student at Mayo Clinic, second-year medical student, or an undergraduate student at ASU. Now, in looking at this, we use CFI methodology, which is a discover phase where you go in and you really do in-depth ethnographic work, you look at the needs of the user, you do workshops with them, and we're just moving out of that phase now into what we call a development phase, where we're prototyping designs, we're trying them out with people, we're seeing kind of what works. So I'm not gonna talk about the solutions or anything like that. I'm gonna talk mostly about, I think what John mentioned at the beginning, like really getting to know someone. Like really getting to know who these students are and what their life is like. So I'm going to introduce you now to Sam. Sam has a 3.4 GPA. His BMI is 23, and he has 200 Twitter followers. So do you think Sam is healthy? I think so. Do you think he's smart? He has good intelligence. Do you think he's stressed out? It's a big reason why ASU invited us there to do this work. College student stress is on the rise. Over 50% report that they've been overwhelmed in the last year. 49% describe in the last year their academics as being traumatic. They use that word. That's in the survey. So I want you to pay attention to Sam's GPA and his Twitter followers. What do you think of him now? Is he healthy? Is he stressed out? Is he smart? We're talking about this because data is becoming more important, right? Within healthcare and education, we're collecting large data sets about patients, about students. Number one, how do we make sense of that? What does it mean? How do we extrapolate from that data to say, what's this person like? What's their experience like? How do we use it in healthcare to be able to have communication with the patient? And of course, the data is going to get even larger when it comes to genetic information, picking up all kinds of signals on cell phones, tracking everything. So these data sets are going to get really big. So we're talking about, how do students interact with that? How are they seen through this data? How do they see themselves? How do educators, how do healthcare providers see them through this data? And this is Anna. Anna has a 3.6. Her BMI is 20, and she has 327 Twitter followers. So if you could pay attention to her BMI and her Twitter followers for a minute, it goes really down. So how healthy do you think she is now with those numbers? We're in dialogue with students about these kinds of ideas around privacy, around data capture. And that's the big question that we're asking. Who are college students today? On a daily basis, we go around, who are college students today? What are they doing? Who are they? When you hear those words, college and student or medical student, and young adult, you might think all of these things like millennial. You might think that they're narcissistic comes to mind. There's been a lot of things like that, online, a lot of articles about that and books about that. They're globally aware. They know more about the world now than we may have known when we were their age. They also have a sense of community that's we're learning, it's very specific. It's peer-to-peer. It's not just take care of people who have the same kind of problems, health concerns that I do. It's I want to take care of my friend that has that health concern, the person who's on my floor that I actually don't even know their name, but I know they're suffering. There's this idea of like community care that comes out of college student health and well-being that we're looking at. Also, college students in general now, I think that we think about them as like eating unhealthy food all the time. The primary thing that they asked for was like, if you could change one thing on campus, what would it be, right? Asked 50 students this question. Over 40 said more salad, right? Like more salad, more available fresh food on campus for us to be able to eat. It's not what immediately comes to mind, but then the question becomes, how do we get that to them? So what are the structural things? What are the behaviors? How do we really engage college students? That's what we're working on at CFI, but we thought, who better to talk to you about college students than college students themselves? So I'm happy to introduce you to our student research team. We have 2 sophomores from Arizona State University, Alexis and Autumn Stewart, and we have 2 Mayo medical students, Prakriti Gaba and John Smistad, and they're going to tell you about their work as one of the 200 students who have been involved in this project over the last year. Alexis and Autumn. You go, girl.
Hi, how are you guys doing tonight? I can't hear you, sorry. What? One more time? All right, that's good. My name is Alexis Katinchi. I'm a sophomore undergraduate student in Barrett the Honors College at Arizona State University. I've been working with CFI and ASU on this project to basically understand health needs of college students and how we can create programs to increase healthy behaviors in college students. Another side goal we had was to come out to you guys and explain the college demographic. So when you go home, when you look at the patient experience, you can cater that towards college students a little bit better. So what we did was, I was involved in qualitative design research. I did ethnographic interviews, sat down one-on-one and in workshops with a whole bunch of college freshmen, and then did online portions for upperclassmen students like sophomores and juniors. And so basically what we did was we asked them a whole bunch of questions, like what their strengths and weaknesses were, where they were stressed out, how they coped with that stress, what they thought health was, and what a successful college student was to them. And what we found was that college students are a lot like you guys. Believe it or not, we're a lot like you. We want to work hard to get the job done, even if it requires staying up late.
Yeah, I totally agree. Honestly, we're just trying to sort out our life, we're trying to sort out our health, and we're just doing it in a way that makes sense to us.
Yeah, so imagine like when you guys have your first kid, you're not the best parent. Come on, be honest. You're going through this transition into a parental lifestyle. And we're going through a similar transition, a lifelong transition. Most of us have been on our parents' insurance. Our parents make doctor's appointments for us. Going to college, some of us have to get our own health insurance or find doctors on our own, or when we need a prescription, we have to go to the doctor, we have to find a pharmacy, we have to like coordinate when we need a refill. So there are a lot of things that we go through in transitioning from high school to college that are cool to look at. And so we asked them their strengths and their weaknesses, and what we found were that it was pretty easy for them to pull out what their strengths were. You know, they had confidence, or they were positive, they were determined, but what was harder for them was pinpointing the weaknesses. So some of them said they wanted, character traits like confidence and diligence, but what a lot of them said they wanted were physical abilities, like a photographic memory, or the ability to relax, or to slow down time. And what does that say about healthcare? What does that say about how we can take this patient experience and cater it towards college students since we can't give them a photographic memory. Yeah, you're laughing, but it's true. So we decided to look at stress and what college students were stressed about. You know, when you think of a college student, a successful one, you think they're pretty healthy, right? I mean, she has a 3.6 GPA, so she must be healthy. What we found out was that college students, their success doesn't always match up with their health. Take Anna, for instance, 3.6 GPA, but she could be struggling with anxiety or depression, which a lot of college students face. So looking more at the stresses, we asked them how they cope with stress. And what they told us, a lot of the time, they use social media. You know, we're in a technologically savvy age. We get on social media all the time. So how they coped with the stress, how they relax, or they take their photographic memory, they remember pictures of their friends on Facebook, or you know, they want the ability to slow down time. They don't notice the time going by if they're on Facebook or Twitter or Instagram. So we wanted to look more of that, and Autumn was actually hired to do just that. Here you go.
Hi everyone, my name is Autumn Stewart. I'm a sophomore at Arizona State, and my first question for you is, when college students are tweeting, who exactly are they tweeting to? Parents are always complaining about our tweets, but they never consider that we're not tweeting to them, our doctors, or our professors. And guess what? We're not tweeting away at life either. We're tweeting to our friends and other students who are just trying to fit in. You know what? We're trying to connect with our world. And the reason why we're so socially involved is because we love to gain information and, like I said, connect with our world. And yes, I say our world because there is a world that exists with just us, to us. We tweet because we love to gain this information. We love retweets, we love favorites, and we love documenting information.
Speaking of, we should document this and take a selfie.
Totally.
Okay, ready? 1, 2, everyone smile, you're in the picture with us. Yay.
Social media is not a choice, and if you aren't on social media, it's like you don't exist. It's like being left out of a big inside joke that everyone gets but you. Twitter is a different world, and it allows us to escape from the lab reports, the exams, and the papers. You know what? Even on Twitter, we post our health information. We post our accidents, we post our eating habits, and we even post when we're not feeling well. We know about health information as college students, and we're sharing it as a community, looking for someone to care. My goal as a social media advocate is to send viable health information out to students. You know what? I'm going to pass it along to Prakriti Gaba and John Smithsteed, 2 Mayo medical students. Thank you.
Thank you. They got it.
I think she's got one.
All right. Perfectionists, toppers, a bit obsessive compulsive. John, do you know who I'm talking about?
Well, Prakriti, I'm thinking perhaps you're talking about our fearless leader and designer on this project, Barbara Berry.
Well, that's a funny thought, but actually I was describing us. We as medical students, especially at the Mayo Clinic, strive to do what's best for our patients, putting the needs of the patients first. We aim to please our teachers, our professors, and our residents and our peers, and even our faculty. Yet what we forget in the midst of trying to impress everyone and treating our patients is our own mental health and well-being. And nowadays, with all of the stress for medical students, we actually have our own unique stressors, and they include stressors of trying to ace examinations, such as the oh-so-dreaded USMLE. Other stressors including trying to maintain a normal life with, going to the gym or trying to just maintain normal family and friend relationships. I think John will delve into a bit more detail about our daily stressors.
Absolutely. Stress is an ever-present reality in the life of a student. As a college student and now as a medical and graduate school student, I can report that the nature of this stress is multifactorial, but stems from the fact that we are expected to function as people that can balance a variety of different demands in our time. Let me describe 2 things that are very real stresses in my life. Seeing patients as a student is a very big stress. As a second-year medical student, the majority of our clinical learning takes place in the hospitals while doing rounds with physician and student teams. Inevitably, part of the experience always involves a physician handing me or another student a room number and saying, go to that room in the hospital, take a thorough history, do a physical examination, document it, and report back to me. This can be a little bit stressful. As a student who's also pursuing both MD and PhD degrees, another thing I need to do is figure out whose lab I'm going to join for my PhD thesis. This is a choice that will determine my future skill set, my reputation, and the entire course of my scientific career. Another very big choice. I'm not here to whine about these things to you, though. These activities are all expected and are part of the deal that we all signed up for. And many of us have worked very hard to be here. In addition, I would argue that some stress, at least, is very, very important for stimulating the kind of critical engagement needed to really learn something well. On the screen in front of you, or to the side of you, I guess, you see a simple curve illustrating an important finding from decades of immunology and neuroscience research. That was conducted on both laboratory animals and surgical residents. And the point of this is that some stress actually improves learning, up to a point after which stress becomes detrimental. Stress is an emotionally activated state that can be quantified by measuring things like the stress hormone cortisol, immune system activation, or the amount of certain neurotransmitters in the brain. These are all things that impact learning and memory. The point of this image is that stress is something that we can potentially optimize. Ideally, as students, we want to get to the top of that curve, to that orange dot circle is optimal. That's where our learning will be the best, where our board scores will be the highest, and our clinical skills will be the best for our patients.
Yeah, well, one start and stepping stone to actually developing a solution for the stress is to develop a model to actually understand medical students' stressful lives over time. And in fact, that's what we've done at the Center for Innovation at the Mayo Clinic. We are developing an initiative to basically model medical student stress and to assess their mental health and well-being. In this effort, we've created a survey that will be implemented approximately 6 times over the first year of a medical student's year in medical school, and they will be assessed on a variety of different factors. The questions will ask them things like, in general, how would you rate your physical health? Furthermore, they will ask questions about their emotional health, their behaviors, and their moods, and how they change over time. And over the course of a year, with the implementation of the survey 6 times or even more as we see needed, we hope that we will be able to detect stress, distress, and even more severe disorders that may be plaguing medical students, including mental health disorders and burnout rates, which are very common in a variety of medical schools in the United States. We hope that this effort will eventually be able to develop a map for medical students that they can use on their own to see the change in stress over time, and also to understand their lives and their lifestyle a bit better.
Yeah, a fine line exists between stimulated engagement and burnout. In a place where failure is really unacceptable, we as students are motivated to push the limits of our productivity into pathologic stress states. This is fueled by the perception that failure is lethal to a career and life trajectory. And although we are not exactly qualified to comment on whether or not this is actually true, we hope not, we think that this idea that failure is lethal is a real danger to medical education.
Now, it may be ironic that you see 2 medical students here on stage trying to assess the well-being of medical students, but if we don't do it, then who else will? We, as medical students, have the direct incentives, and we clearly understand the stress felt by our own classmates. And thus, we hope that our efforts with the CFI will be able to make the lives of our successors in medical school less stressful and more successful. Thank you. And now we'll bring it back to Ms. Berry.
Hey, everybody. Great job, yeah.
So to wrap up for a minute, I just wanted to say that I think Prakriti said it really well. Student-centered design, students really involved in the process, getting their knowledge, having them be able to tell us what the needs are directly, And I wanted to let all of you know that I think you've just met some of the champions of student-centered health and well-being, and maybe even healthcare in general. And if you look around you, there are a good number of college students here today and here for Transform. So seek them out at some of the events and just talk to them. Ask their opinions about things. Tell them the problems that you're trying to work on, because I can guarantee you they're going to give you a fresh perspective. Thank you. John, Procurty, Alexis, Autumn, come on back.
So thank you very much. Let's all just take a nice breath. Okay, let's relax here. You're among friends. You're not alone, as it says here. Where do you think your stress comes from? Do you think it comes from the values handed to you in medical school? Does it come from your parents? Does it come from expectations that were delivered at one time or another? Does it come from inside you? Thoughts?
Should I take it?
Yeah, take it.
Well, I know that a lot of my stress is probably self-imposed, that a lot of the goals that I have that stress me out are things I've set for myself. Being in medical school is a goal that I had, and now that I'm here, there are expectations, but those are things that I've kind of caused, that if I hadn't had that goal to begin with, I wouldn't have this current stress.
So you'd be less stressed out if you were working at Dairy Queen?
Well, I don't know about less stress. The stress would be different for sure.
Do you think, describe what it was like when you got into medical school and how that sort of stress came upon you, that you had sort of achieved something that you'd always wanted, and suddenly the reward is more stress.
Well, the reward is an opportunity, and with the opportunity, you can either take advantage of it or not. And therein the stress is, that you have a choice to make, that either you do things that capitalize on the opportunity or you don't. And along the way, there are tests that we have to pass to be licensed physicians, and those are bars that we for sure have to get over, but I think all want to do better than just pass the bar.
How does stress manifest itself in your life?
Yeah, well, I would kind of echo what John was saying as well, but in a slightly different viewpoint, when I got into med school, I was actually less stressed because getting into medical school was this big barrier that I was able to get over. And kind of once you're in medical school, you have a lot of opportunities that are given to you, particularly at a place like this, which I was very thankful for. But then once you're in a place like this, you do have higher expectations for yourself, as do your faculty. And so with those expectations and things piling up, then we develop a more stressful life once again. And then I think it'll build up similarly to residency. And once you get into residency.
Does this function like hazing? I mean, they were all stressed out, so then, damn it, you have to be stressed out if you're going to be a doctor.
I think it could possibly be, but I think it's also just the types of people that medicine attracts are individuals that are very motivated and they want to try to do the best that they can for themselves and for others. And so they'll automatically want to take on more things, and that will create a stressful lifestyle.
So for you two, steer clear of medical school, right? What are your thoughts about stress? I mean, you're undergraduates, come on.
But it's still stressful. You know, you're coming out of high school, and I don't know about anyone else, but I felt like I always had to be better a lot of the times, and I always wanted to be better than my parents, you know, a lot of the time. So that's a lot of pressure that I put on myself, and I feel like a lot of my stress, more than likely, comes from like me, myself, and I'm always telling myself that 85 is not good enough, and it should have been a 90, and like, that 91 should have been like a 96. I feel like still.
Boy, that really sucks. Yeah.
Oh,
how do you live with yourself?
It totally does.
That's horrible. What compromises do you think you make with your health by engaging in sort of stressful patterns of behavior?
I have a perfect example because last week I contracted a virus, but I'm just like any other student. I put everything before like my health, and I got up and I went to work, and Barbara told me, no, you go to the health center right now. And so I had to go to the health center, and you know, as a student, I feel like they put a lot of pressure on us, and I do put more than likely like my school and like my job before my health always.
Did it feel good to have someone take care of you at the health center?
Oh yeah, it felt awesome, and it felt really nice to have a coworker who actually said like for the first time like go to the health center. Like, no, it's okay. Like, go.
I had to say it 3 times. You were like, no, I'm just going to do the meeting. I'll be fine. So 3 times. And then you took a snapshot of the note from the doctor on your phone, and you sent it to me in a text.
Yes.
Right? Yeah. That's how we manage the whole thing.
You know, you're very intelligent, and all of you are very accomplished, but clearly the stress and these patterns of behavior keep you from being the kind of empowered patients and medical consumers, healthcare consumers that we've been talking about for the last 2 days. What do you think would change that, Alexis?
Honestly, I'm not too sure. For me, at least, I have a 4.0 right now, and I want to keep that 4.0. So if I get sick, I'm going to go to class, especially if teachers are like, you're going to miss points if you don't come. It can't be excused no matter what you do. If you don't come to class, you're going to lose something.
And then you'll
I'm
have to
gonna
sit
go.
with all the 3.9
I can't.
GPAs.
Once I set myself up, I'm in the honors college, so I have rigorous classes, and I'm so dedicated to trying to keep this 4.0 that I was like scared about coming out here and missing class today, and I was so relieved that there's flooding right now happening, so they canceled my professor's class. He said, I'm not coming in, you guys are good, we'll meet Wednesday. I said, yes, I'm not gonna miss out.
So you yearn for natural disasters so you can maintain your 4.0.
Yes, if that's what needs to be done, sure.
This sounds like a healthcare crisis,
Right.
Barbara.
It's a healthcare
How do we
crisis.
change that sort of orientation so that someone like Alexis doesn't leave college with, acute renal failure?
I know it really is. I mean, I think maybe all of us can relate to this idea of like you want to postpone it. There are these like reflexes, I would call them, like my insurance doesn't cover that, or I got to go do this other thing, or I'm going to lose my job. And it's like part of the structure, what you were saying, like the structural way that things are managed. It's part of the sort of constant stories of stress that we tell ourselves, that everyone tells us. And part of our work is to kind of like unpack that idea of stress. Is it like just the stress where it's like, oh, I'm stressed out today because I have a deadline? Or is it like distress, which happens? Or is it distress around mental health issues where someone is like in an episode of a mental illness that they need help for? Or is it someone who has a risk where a stressful episode is going to send them on their first depression or first anxiety disorder? So we're unpacking that, and then we're looking at like from the big picture, like what could you do as an entire community to deal with this? So there's a group of 10 students who are working with the Counseling Center to do grassroots stress reduction all around campus, which there are 75,000 students on campus. So from kind of that level to the university level, like how can you put services in place? But also this sort of, I call it kind of like the beautiful minutia, which is, like online exams, like you're living online sometimes, online life, and so sometimes what happens is like the wireless cuts out when you're in the middle of an exam. And so look at their faces, right? So the wireless cuts out, but like the clock is still going on your exam. So you're like, while you're reconnecting, you're losing time. So there's like these little tiny bits, and if you could think of those bits as like those things can add up, or if that catches you on a bad day. So how do we smooth over some of those if we can, and kind of triangulate and look at it from all these different kinds of perspectives to hit at the stress?
So even suggesting that the Wi-Fi should suddenly go out causes a traumatic sort of flat. Look at that face.
Yeah.
Did you four listen to Dr. Amit Sood's?
Yes.
Yeah. Did any of you think that approach to life could sort of assist you in some of your stress reduction?
Absolutely.
So who are you grateful for, Ms. 4.0 over here?
Who am I grateful for in terms of?
Just if you closed your eyes, what's the first thing that would come to mind that would evoke gratitude in your heart?
I'm grateful for my parents. My dad traveled for the longest time to go to work, like an hour and a half, so that we could go to the best public school system that was in my area of Texas. So I'm grateful that they gave me all the opportunities in the world to succeed and to also build character and take on responsibilities in life so I can actually maintain my 4.0 without too much stress.
I bet they would be grateful if you could also just take a breath and relax with that too. What about gratitude for you?
I think it's the same. My parents, they're willing to do anything for me. Actually, I'm from Michigan, so when I did go to ASU last year and I had a hard time adjusting, they put the house up for sale, the house sold in one day, and then now we all live in Arizona. And I feel like if you can move so far away and like leave family just for me, I should be able to take at least like 2 minutes of my day and like send gratitude out to all of them.
That sounds
Absolutely.
good. That sounds very healthy. The two would-be doctors here. Gratitude?
Yeah, I'm definitely very thankful for my parents and for all the support that they've provided throughout the years. In college, After college, I worked in the laboratory, living in their house, before I got into medical school. I've had tremendous support, and every day I wake up grateful for that.
So parents, you're not going to say the Kardashians, right?
Oh, well, that was on my mind, actually. But I'm also grateful for my parents, but in a kind of different way. My parents are also doctors, so I kind of had this influence since I was little. In fact, when I was 3 years old, my parents have a video of me picking up the phone and saying, "Hi, this is Dr. Gaba." And so I think I did have a bit of influence since that age, and they've been very helpful and inspiratory throughout.
Well, you come by it rightly. Final thoughts, Barbara?
Well, do I get the gratitude thing?
Yeah, sure. Absolutely.
Okay, so for my family and friends, for sure. But then the other thing that I think is important to health and well-being is just the opportunity to do meaningful work, like work that I'm attached to, work that I really love to do. So I think that's another sort of piece of the puzzle for me in terms of health and well-being. And then also, it's just a call to stay tuned. I mean, we're in the discovery phase. We're hopefully going to be back here next year to see all of you and show you what kinds of concepts and designs we've come up with and what the results of the survey are and how the social media sites are going.
Well, we'll be thrilled to see it. Thanks so much.
Thanks,
Thank you.
everybody.